as you know, diabetes is like a chronic metabolic disorder, and irrespective of the age group that has got the diabetes, they are always more prone to develop any kind of infections in their body, be it a bacterial infection, viral infection, fungal infections. So we know from our common knowledge also that if any individual has got a very higher blood sugar, their cut wounds or their wounds take a lot of time to heal. So just like that, if an individual is diabetic and his blood sugar is not under very good control, especially during this pandemic period, they will definitely have a higher chance of developing more severe COVID infection if they catch the virus, as compared to that individual who is diabetic but has kept his blood sugar under good control during this pandemic period. So control of the glucose level, or we call it the glycemic control, is very, very important in this pandemic period. So irrespective of the age group of the person, it can be even a middle-aged person, office working person, or even an elderly population, or even our type 1 young diabetic individuals. If their blood glucose levels are fluctuating, there are a lot of ups and peaks and troughs happening in their blood glucose level, their glycated hemoglobin or HbA1c level, as we call it, is on the higher side, then these individuals will be more prone to develop the severe COVID infection, that is the COVID pneumonia, and they might even require oxygen or hospitalization. That's what we have seen from our experience. The ones who are keeping their glucose under very good monitoring and control, they're following up with their doctors, even if they're developing COVID infection, from our experience, we have seen them go through a milder or a moderate course of the disease. There is also one more thing that has to be told here. Now, you see, while treating COVID infection, we are often using steroids. And steroids, as we know, also increases the blood glucose level. Steroids are essential for the treatment of COVID. In fact, it is one of the mainstay in the treatment of COVID. But due to the use of steroid, these patients who are diabetic, definitely they will have a flare up in their blood glucose levels. So it is very important that, even if a person doesn't have a COVID infection, that their sugar levels are kept under control, that they follow up with their diabetologist or doctors on time. If the individual is diabetic and is developing COVID infection, then very strict good control of the blood sugar is required. We even put our patients on insulin during this period when they are in the hospital, and we try to keep their blood glucose levels under very good control, because it definitely has an impact on the outcome of the COVID infection.
Okay. With a network of over 11,000 doctors, avail quality healthcare services 24/7 on CareClues. Book your online or in-clinic consultation today. Thanks for watching. Don't forget to like, share and subscribe.